The topics I want to look at specifically in the time that we've got available this morning. Firstly, just a couple of practical things as to when during the course of proceedings or pre-proceedings, more to the point, should statements be drafted, who needs to give evidence and therefore have witness statements prepared, where, for example, there may, on a claimant side, there may be many people providing care in a substantial case, or on the defendant side, where there may have been a large number of individual clinicians involved in a patient's care. One aspect that I'm going to look at in particular in respect of defendants' witness statements is the question, when one is taking witness statements from clinicians, of the question of what is and what is not opinion evidence, what is the dividing line, and therefore what are the proper boundaries of clinicians' witness statements. Then from the claimant's perspective, and also in some cases the defendant's perspective, the issue, a classic issue in clinical negligence cases in terms of factual issues, is where the medical records differ to a greater or lesser extent than witnesses' recollection of events. So we'll have a look at just one or two cases that have dealt with that issue and as they inform witness statement drafting, where there are those issues of fact in a case. And then finally, and this is very much so claimant orientated, going to look at witness statements in consent cases and look at the need for a cogent explanation by a claimant in terms of causation in consent cases, i.e. the question of, well, if I had been told about risks X, Y, and Z, as well as risks A, B, and C, why I would have declined or at least postponed the surgery which I in fact had.